Hello everyone, let's try to solve this question together. So this term newborn infant is on bubble CPAP and oxygen of 25%. Based on the chest X-ray finding, the best action is to pause the slide, zoom the picture. Okay, the correct response here is follow X-ray. So it's a clinical follow-up. So let's see why the others are wrong. So give surfactant. So again, surfactant deficiency is usually common in preterm infant, not in term infant. One reason. Second is oxygen requirement is still low. It's not a high requirement. So an X-ray also, although you see like we all agree that there is some haziness here and there is some streaky pattern on this side and also on this side. So X-ray wise, this baby might qualify for surfactant, but basing on the term and the oxygen requirement, I think surfactant should be reserved and not the first choice. Why not changing to high flow nasal cannula is not needed. Basically, bubble CPAP is better if this is a case of transient tachypnea of the newborn, or like if you're suspecting a pneumothorax here, which is very less likely. But again, we'll see. Even in the X-ray, if you see there is an artifact, it gives an impression that there is some pneumothorax, but you can still see some markings on the periphery. So it's not pneumothorax. If it was a pneumothorax, then changing to high flow cannula become the right choice, but it's not the case here, so that's why this is out. What about obtaining an echo? The heart gives an impression on the larger size, but again, infant is not on high requirement, so we can wait on getting an echo. So these are, the follow-up X-ray. As you see, there was suspicion of a pneumothorax, which was gone. The lungs are well expanded, and this was not a surfactant deficiency lung. And this is, there are 3 articles, and if you guys have time, pull those articles. Although this is not related to this presentation, but even with the management, that this article recently where they talk about using nitrogen washout. And they prove that is better than using the target oxygenation. So let me explain what they mean by that. Suppose if the baby is desaturating to 87 and then you want the target to be 95, so you start oxygen, but you don't target, and you don't go 100%. You just go with the targeted saturation. As compared to nitrogen washout, you start with 100% and you don't look at your saturation. You keep it for 8 hours and you call it nitrogen washout. The other 2 articles which were published earlier, like 10 years back, and that shows that there is no difference basically if you use 100% oxygen. And of course, you know that there is some ramification with the use of 100% oxygen, because that can cause injury, because oxygen is a drug and it can lead to radical injuries. And I hope you guys have enjoyed the video. Please do subscribe our channel, and you guys have a wonderful day. Bye.